Hello, myself Dr. Gireesh MS, consultant nephrologist at Ramaya Medical College and Hospitals, Bangalore. Today, let us try to understand what are the precautions that we can take to prevent kidney diseases, or the people who are already having kidney problems. Let us look at what are the ways we can retard the progression of this kidney problem. So what I am trying to say is let us try to prevent the kidney disease from occurring, or if at all it is already there, let us try to keep it under control as much as possible. Diabetes and hypertension put together pose a major threat to the kidneys. So one of the most important things we need to understand here is we have to control diabetes and hypertension. Just by taking care of diabetes and hypertension, we might be able to prevent a significant number of kidney disease from happening in the first place. Or if the kidney disease also have already happened, then at least by keeping this diabetes and hypertension under control, we can definitely prevent the kidney disease from worsening. From worsening means kidney disease happens in various stages. It doesn't go to failure just like that. So kidney disease usually starts as a stage 1, and over the time it progresses to stage 2, 3, 4, 5, and in the stage 5, when the kidney disease is so very low or weak, then we might have to go in for dialysis or kidney transplantation. So what we are interested here is to retard the progression, that is prevent the progression from stage 1 to stage 2 or stage 2 to stage 3 as much as possible. It might not be 100% possible, but as much as possible we should be trying to prevent this from happening. And that is where the importance of controlling sugars and blood pressure comes into play. So once we tackle these two basic things, what are the other things that can affect the kidney problem? Most important I would like to talk about here is the common habit of taking painkillers. So whenever there is any problem, people go and take painkillers as and when required without any prescriptions. That is a very dangerous habit. This shouldn't be done. So there are some painkillers which are safe, that can be taken even in patients with kidney disease, just like a plain paracetamol or like a plain tramadol or a combination of tramadol and paracetamol. But most of the other painkillers that are available in the market are unsafe for the kidneys, and hence excessive use of these painkillers should be avoided in the normal population. And in the people who are already having kidney disease, even a single tablet can make them go from stage 2 to stage 5 directly. So we have to prevent the use of painkillers altogether in patients with kidney disease, and in the general population also it should be cut down to the maximum possible extent. And today everyone is so concerned about health sometimes in a wrong way. So that is, they go for many of these native medications without any reason being there, and we don't know how safe they are. If at all it is safe, it is fine. But there are significant number of native medications or alternative medications which might be unsafe for the kidneys. So it is important to understand how safe or unsafe they are before undertaking any such treatments. And any sudden slimming, so all these things are the herbal medicines that are offered for such conditions can be very dangerous for the kidneys, and this has to be borne in mind before taking such kind of treatment. So we have covered most of the important things what can actually affect the kidneys. Then what are the other things? So other things are, again, this is very important and very prevalent menace in the society, that is smoking. Like painkillers, smoking affects the kidneys in a very bad manner, and smoking accelerates the kidney problem about 10 to 100 times. So if at all the problem is that you take a car is going at a speed of 1 kilometer, that is the kidneys are deteriorating somewhere there, it can take that speed from 1 kilometer to 10 kilometers or even to 100 kilometers. So you can imagine that the kidney, which might have lasted for 5 years or 10 years, they will end up in kidney failure within a year. So the smoking is a menace for the kidneys and also to the society. And it's not just smoking, any form of tobacco, either it can be smoking or tobacco chewing or inhaling tobacco. Any form of tobacco is very bad for the kidneys, and that has to be avoided completely. There is no point in bringing down the tobacco consumption. That doesn't work. It has to be avoided completely, especially in patients who are already having a kidney problem. This becomes very important, that tobacco use has to be avoided completely. So these are some of the simple things that we can take. Apart from that, healthy lifestyle. What is this healthy lifestyle? All of us know Heavy amount of non-vegetarian food intake, that is very heavy protein intake, so that is again not a very good thing. Lot of salt intake, again that is not good. So we have to take care that the salt has to be moderate, so or even the lower side. We should not exceed a salt intake of more than 5 grams per day per person, so that is the usual norm. So taking excessive salt can lead on to hypertension, can lead on to more stress on the kidneys, more stress on the heart. So all these things can be avoided by simply taking less amount of salt in our food. So this is one of the simple ways. Then keeping a healthy body weight, so in avoiding obesity, in having a regular exercise program. So these things definitely again will help us in protecting our kidneys in the long run. So these are some simple ways which we can undertake to protect our kidneys, and also if the kidneys are already affected, we can protect them from worsening further. So with this, I conclude my talk here. Thank you.